The chair now recognizes a gentleman from Texas, Mr. Gonzalez, for 5 minutes.
Madam Speaker, I rise today to raise awareness for the severe mental health crisis in our country. 2 weeks ago, there was a terrible incident that occurred in Uvalde, Texas. 19 innocent children were murdered and 2 of their teachers alongside them. And, to me, Uvalde is in my district, Texas 23rd District. And over a year ago, after I got elected, I visited Uvalde and I sat down with the county judge, who's a Democrat, the mayor, who's a Republican, and the local sheriff. And I sat down with them and I said, if I could do one thing, what would that be, gentlemen? And they go, Tony, we need a mental health hospital. They identified this crisis over a year ago. Last year we appropriated $2 million towards that hospital. It's a $25 million project, and I'm working on the remaining $23 million to get that over the finish line. But this is something that community asked for. There's so much division here in Congress. There's so much hate and rhetoric that gets spewed. I think mental health is an area that can bring us together, that can unite us as we go forward, not only as we reflect on what happened in Uvalde, but across the country. COVID did something to this country, and we're coming out of that. And I think part of the mental health crisis that is going on in our country has to be addressed. It's heartbreaking to see what happened, to be there, as the Uvalde community heals and comes together. What I will say is this mental health crisis goes beyond those that are looking to cause harm to themselves and others. Everyone, I would argue, everyone in that community needs mental health, to sit down with a mental health provider. My staff included. Our team essentially had turned into a mini FEMA office where we were answering all kinds of different claims every day and having to hear these horrendous stories and having to hear the issues that our community was dealing with. So, this crisis is very deep and it's very sad, and it's an issue that this body needs to address. And it needs to start early on, not wait until when an incident occurs. But we have to start very early on. This shooter, this gunman, was a troubled young man for a very long time. It was no surprise to a lot of people what occurred. If we could have got ahead of the issue instead of waiting till the problem happened, I think that's critical. Another thing that a lot of people don't realize, the day of the shooting, there was actually a young lady that had suicide ideations, and 2 of the local law enforcement officers had taken her to San Antonio. This was hours before the shooting. What does that mean? That means the community of Uvalde has a very deep mental health issue that is popping up every single day. And Uvalde isn't unique. It isn't just this one small town and this one incident. We've seen it happen all over the country. So I urge this body to come together. I urge Congress to come together and use this terrible incident to unite us in finding real, tangible solutions. And part of those solutions is identifying mental health resources which we can provide directly to the communities of need. And with that, Madam Chair, I yield back.
Gentleman yields back.